Dear students, welcome back. In the previous session we have discussed about knee complex. Now in this session we are going to discuss about the ankle foot complex. Okay, mainly in this session we are going to see the introduction for this ankle and foot complex and also some of the terminology or definitions of the motions which are taking place in the ankle and foot complex. Okay, so the ankle and foot complex is structurally same as to that of a wrist and hand complex of the upper extremity, but it is having a number of distinct differences to optimize its primary role to bear weight is for this ankle and foot complex. The complementing structures of the ankle foot complex permit both stability as well as mobility depending on conditions acting on it. Okay, the foot is able to sustain large weight bearing stresses while accommodating to a variety of surfaces and activities. Okay, and the foot must the ankle and foot complex must meet the stability needs of providing a stable base of support for the body in a variety of weight bearing postures without undue muscular activity and energy expenditure. This is one of the main function. And also this foot and ankle complex acting as a rigid lever for effective push off during gait. Okay, the stability requirements can be contrasted to the mobility demands of one is dampening of rotations imposed by the more proximal joints of the lower limbs, that is knee, hip joints like that, and also it is being flexible enough so this the skeleton, the entire skeleton of the ankle and foot complex as well as the structures which are associated with this complex are being flexible enough to absorb the shock of the superimposed body weight as the foot hits the ground, and it is also permitting the foot to conform to changing and varied terrain, that means surfaces on which the foot is placed. Okay, so these are the main functions of this ankle joint. So to meet all these such kind of requirements, so to do all such kind of functions, here the structure of the foot is very complex here. Okay, that means it consists of the ankle and foot complex consists of 28 bones. So all these consist of 28 bones, 7 tarsus, 5 metatarsals and 14 phalanges. Okay, and these and forms 25 component joints. So being 28 bones, and these form 25 component joints. These joints include the proximal and distal tibiofibular joints. Why? Because the ankle joint is mainly formed by the distal tibiofibular joint, isn't it? And this distal tibiofibular joint is always accompanied with the proximal tibiofibular joint, but the main function of the tibiofibular joint is on the foot complex only, ankle and foot complex only, not which is related to knee complex there. Okay, yes. So next one is these joints includes proximal and distal tibiofibular joints, and then the talocrural or talocrural means here we'll get the ankle joint. Talocrural or ankle joint, both are same. And next comes to the talocalcaneal or subtalar joint. Next one is the talonavicular and the calcaneocuboid joints, the 5 tarso-metatarsal joints and 5 metatarsophalangeal joints and 9 interphalangeal joints. Okay. So these are the different kinds of joints which are seen in ankle foot complex. And to facilitate description and understanding of the ankle and foot complex, the bones of the foot are traditionally divided into 3 functional segments, that is hind foot, midfoot and forefoot. Normally this hind foot is called as posterior component, which is composed of talus and calcaneum. Talus and calcaneum, and the joint formed here is talocalcaneal joint or subtalar joint. Okay, the midfoot commonly consists of navicular, cuboid and 3 cuneiforms. Navicular, cuboid and 3 cuneiforms forms the midfoot. Here we can find this intertarsal joints. Of course, talus and calcaneum is also called as intertarsal joints. That is one of the major intertarsal joints. Here this navicular is also forming joint with talus as well as calcaneum, forming talocalcaneo-navicular joint, and this calcaneum which articulates with the cuboid forms calcaneo-cuboid joints. Okay, and then this one is these navicular and cuboid with this talus and calcaneum forming transverse tarsal joints also. And these small intertarsal joints are navicular bones articulating with the cuneiforms and cuboid articulating with the lateral cuneiforms. So these are the joints which are commonly found in midfoot. Okay, and coming to the forefoot, so that is the anterior segment which is composed of the metatarsals and the phalanges. Metatarsals and phalanges. Here the joints we can found is tarso-metatarsal joints as well as metatarsophalangeal joints and the interphalangeal joints we can see here. Okay, yes. So these are the different components of the foot and different kinds of joints which are formed in different components of foot. And also the other important thing here you have to know is ankle or foot pathology can be related to the integrated multifunctional structures of the ankle foot complex combined with the demands of stability and mobility placed upon these structures. Okay, and also additionally this ankle and foot complex must not only respond to forces from the ground, forces from the ground, but also from the superimposed forces which are coming from spine, hip, knee, and all these forces also imposed on the ankle and foot complexes. So structural abnormalities in any of the superimposed structures can lead to altered movements between the joints and contribute to excessive stress that result in injury to the ankle and foot complex. Okay, so those things also we are going to study in this chapter. So in this chapter we are going to study the components of the ankle and foot complex. That means different kinds of joints and what are its axes. So before if you take any joint, for every joint we are going to discuss about the structure of the joint. In this structure, what are the articulating surfaces, as well as what are the ligaments which are giving support to this joints. And coming to the function, what are the movements taking place in this joint, which includes osteokinematics as well as the orthokinematics. Okay, that means which includes axis, on which axis all these movements are taking place. Okay, so what are the types of movements which are taking place in each joint? All those things we are going to study. And to understand the function of this individual joints, that means what are the types of movements which are taking place in these joints, you people should know the terminology here. So we have studied so many names of the movements in the different joints. What we have discussed earlier, like flexion, extension, abduction, adduction, like this. So many terms we have studied in the previous joints, but here the terminology is somewhat changing here. So for that reason, so the movements as a whole, what are the movements taking place as a whole in the ankle and foot complex, now we will see. So there is a unique set of terms which are used to refer to motion of the foot and ankle. And of course, the same terms are used at most of the joints of ankle and foot. And now we are going to discuss about the terminology which are related to this ankle and foot complex. So as we have seen at the other joint complexes, so some of the cardinal planes, so as all of you know that sagittal, coronal and transverse planes, you know, and also the joint axes which are oblique and cut across all the three planes of motions. Okay, the obliquity of the axis and implications for motion and function we are going to describe in the later topics. Okay, so first the main three motions of the ankle and foot complexes that approximate the cardinal planes and axis are, one is the dorsiflexion and plantar flexion. So dorsiflexion and plantar flexion, which is taking place in the coronal axis. Okay, coronal axis. In the coronal axis, this dorsiflexion and plantar flexion is going to takes place. That means in sagittal plane, this dorsiflexion and plantar flexion is going to takes place. Okay, next inversion and aversion. So this inversion and aversion which is taking place in the AP axis. So inversion and aversion which is taking place in the AP axis, or we can call it as the longitudinal axis. Normally this axis fall on the longitudinal axis of these joints. So inversion and aversion, and abduction and adduction which are taking place in the vertical axis. So the vertical axis, this abduction and adduction is going to takes place. Okay, so dorsiflexion and plantar flexions are motions that occupy approximately in the sagittal plane around the coronal axis. Normally the dorsiflexion decreases the angle between the foot, leg and the dorsum of the foot, whereas the plantar flexion increases this angle. So what is happening? Plantar flexion means the foot this is the plantar flexion. So this is the leg and this one is the plantar flexion. Dorsiflexion means like this. So what is happening here? The angle between the leg and the foot is, dorsum of the foot is increased in plantar flexion. In the dorsiflexion, that one is decreased. Okay, at the toes, here we can find at the toes, motion around a similar axis is termed as, here the terminology is going to change here, that is flexion and extension. Bringing the toes up is called extension, bringing the toes down is called as flexion here. Okay, so inversion and eversion approximately in the frontal plane. The movement is taking place in the frontal plane around a longitudinal AP axis. That is the movements which are taking place in the frontal plane. Okay, so next one is inversion occurs when the plantar surface of the segment is brought towards the midline. So that means inversion means, so this part will go midline. So this will turn up, the lateral side will curl inside, and the eversion, it will move up. Okay. So abduction occurs when the distal aspect of the segment, so this one is the forefoot, okay, distal aspect of the segment moves away from the midline of the body. That means the segment will move like this, then it is called as abduction, and move towards the midline, then it is called as adduction. Okay, and another important terminology here you have to understand here is the pronation and supination in the foot. Normally this pronation and supination in the foot are complex movements. So, and also it complex as well as the composite motions. So these are called as composite motions, and these motions are always coupled with each of the cardinal motions. So that means normally this, for example, the supination, if you take the supination or pronation. So first we will see the pronation in non-weight bearing. In non-weight bearing, pronation is the motion which commonly acts at an axis, which results in the coupled motions of dorsiflexion, okay, dorsiflexion, eversion and abduction causes supination, causes pronation, while as supination, what is going to happen, opposite to these motions is going to take place. Plantar flexion, inversion and adduction is taking place in the supination. So pronation and supination are the composite motions, always coupled with each of the cardinal motions. What are the cardinal motions? The main three motions of the ankle joint are dorsiflexion and plantar flexion, one thing, and another one is abduction, adduction, inversion and eversion. These are the three cardinal planes. Whereas the pronation and supination in the foot, commonly called as composite motions, which are always coupled with these cardinal motions. Okay, next another terminology related to this one is varus and valgus terms. Okay, so now normally the terms that we have already used in previous sessions, we have used these terms for abnormal angulations, isn't it? Yes. However, the valgus refers to an increase in the medial angle. So, increase in the medial angle between the two bones. Okay, whereas the varus are decreasing the medial angle, okay, of the two bones. normally this valgus and varus are used to refer to some deformities, fixed deformities in the ankle and foot complex, whereas other times we are going to use these terms to describe the normal motions also. This is one of the important thing. So an example of common usage to describe the fixed or weight bearing position of the posterior calcaneus. So this is that one. In relation to the posterior midline, with an increase in the medial angle between the two references line being valgus of the calcaneum, that is calcaneo-valgus. This situation is called as calcaneo-valgus, whereas decrease being considered as varus of the calcaneum, so this one is called as calcaneo-varus. So these are all the terms we are going to use when we are going to study this different joints in the ankle and foot complexes. So again we will see the terminology. So the main three cardinal motions are: one is dorsiflexion, plantar flexion, inversion, aversion, and abduction and adduction. Okay, so these are the three cardinal motions which occurs in three cardinal planes. And other terminology related to this ankle and foot complex movements are pronation and supination, and valgus and varus. One is pronation and supination are described as composite motions. These motions are always coupled with two or more cardinal plane movements. Okay, whereas valgus and varus we are going to use to describe the position of the any two bones, okay, with respect to of any axis. So for example, here we have taken calcaneo-valgus and calcaneo-varus. Okay, so these are all the terminologies which are used in the ankle and foot complex. In the next session we are going to discuss about the ankle joint. Thank you.